Hi everyone, welcome to a presentation on care of adolescents who self-mutilate. So self-mutilation can be defined as a general term for multiple forms of intentional self-harm without the wish to end one's life. Most common forms include cutting one's skin with razors or knives. Other less common forms include bruising, hitting oneself, picking or pulling at one's skin or hair, or burning oneself with a cigarette. Self mutilation can be seen as an outlet for negative emotions or may represent anger at someone else or at oneself. Self mutilation is also used as a way of stopping a dissociative episode where the person may feel numb. Patients report that self injury can make them feel alive. So, some statistics 0.75% of the general population self mutilates. Over one half of self mutilators were sexually abused as children. Statistics also show that 50% of individuals who self injure will also attempt suicide at some point in their lifetime. Self mutilation is highest among teenage girls, patients diagnosed with borderline personality disorder, and patients diagnosed with a dissociative disorder. The book also mentions that lifetime prevalence of self injury in adolescents is estimated between 13 and 23%, and that it often begins between ages 10 and 15 years old. Why might adolescents self mutilate? Self injury is usually the result of an inability to cope in healthy ways to psychological pain. Adolescents who have difficulty talking about their feelings may use self mutilation as an outlet to express emotional or physical distress, such as feelings of worthlessness, loneliness, panic, anger, guilt, rejection, self hatred, or confused sexuality. These individuals have a hard time regulating, expressing, or understanding these emotions. It is most often done to alleviate or cut through the psychological pain and numbness. When someone self injures, whether it be cutting or burning, it produces an endorphin effect. The endorphins, which are quickly released into the bloodstream, can result in a numbing or pleasurable sensation in a way that mimics morphine. This provides for an immediate relief to psychological stress. Self mutilation can also be a way to provide a distraction from painful emotions through physical pain or allow the individual to feel something, anything, when they are feeling emotionally numb or empty. Adolescents who feel disconnected or invalidated by their family, peers might use self injury as a way to feel a sense of control over their own body, feelings, and life situations and confirm their existence in reality. Self mutilation may also be used as a way to punish themselves for perceived faults, connect or fit in with others who may encourage this behavior, to attention seek, or to escape responsibility or a situation. Self mutilation is a global problem which cuts through all cultural and socioeconomic levels. However, there are some risk factors which may increase self injurious behaviors. Adolescents are most prone to these behaviors as the early teen years are when emotions are more volatile and teens face increasing peer pressure, loneliness, and conflicts with parents or other authority figures. These times are also when young people often question their personal identity or sexuality. Some adolescents who self mutilate are socially isolated. Traumatic events such as neglect, sexual, physical, or emotional abuse, or death or severe illness of loved ones can also lead to self injury. Self mutilation is commonly associated with certain mental health conditions such as depression, borderline personality disorder, anxiety disorders, PTSD, and eating disorders. Self destructive behaviors are especially prominent in borderline personality disorder, which result in these ineffective and harmful self-soothing habits. Excessive alcohol and substance use are also increasing risk of the behaviors, and people who harm themselves often do so while under the influence of alcohol or recreational drugs. There are also biological and psychological factors involved. Studies have suggested that several neurochemical pathways may play a role in the development of these behaviors, although most findings as of yet are inconclusive. Social media and societal influence may also impact or encourage these behaviors. For example, a study done in 2011 found that the top 100 videos related to self injury were viewed over 2 million times, and viewers tended to rate these videos positively. Per Health and Human Services, about 1 in every 100 people have had self injurious behavior, so it is important that nurses are aware of the signs and symptoms associated with self injury in populations which may be at higher risk for self injurious behavior. Non suicidal self harm is understood to be a maladaptive coping mechanism. However, signs and symptoms of non suicidal self injury can vary greatly, especially as self harm can present in many different ways. Common external signs of self injury are listed on this slide and include physical markings, inappropriate dress for the season, and comments regarding friends who self injure. Research has shown that no significant prevalence in self injury between different genders, socioeconomic statuses, and race and ethnicities. However, research has shown that there is a higher risk of self injury among individuals who identify as part of a sexual minority group. Adolescents have the highest rate of self injury. However, self injury is also a concern for young adults and adults. Additionally, studies have found that most self injury is a product of a pre existing disorder. However, this is being debated. One study found that most people who went to the emergency department for self harm met the criteria for a psychiatric diagnosis. It is important for nurses to be aware that these populations may be at higher risk for self harm behavior. Possible long-term effects for patients who self-harm include social isolation, scarring, permanent damage to their body, infections, and possibly fatal injuries. Although suicide is not the intent of the self-harm behavior, one study found that individuals who self-injure are 18 times more likely to commit suicide than those who do not self-injure. Self-injury also has long-term effects on the patient's caregivers and family members. Parents of young adults who self-harmed have an increased risk of stress, anxiety, and depression. Social isolation related to social stigma also increased feelings of isolation among parents and siblings of individuals who self-harmed. It is important for nurses to do an initial assessment for risk of unintentional lethality. Assessing patient self-harm behaviors can increase patient safety as the patient may not be aware that specific self-harm action can cause unintentional fatal results. Gathering information regarding what external events may have preceded the self-injurious behavior may also be significant in developing effective interventions and alternative coping mechanisms. A medical history of previous self-injury would also be significant in assessing patterns of behavior. The nurse would also take into account cultural differences. For example, piercing is a common practice, it would not be considered self-harm. Lastly, it is important for nurses to assess their own feelings, as self-injury can cause anxiety, and effectively addressing those feelings can help the nurse to maintain a therapeutic relationship with the client. The first intervention that a nurse should implement is developing a therapeutic relationship with their patient. This will help to show that you are on the patient's side and are there to help them. Encouraging communication is another key intervention because this can prevent self-harm from escalating as well as move towards stopping the patient from self-harming altogether. If they can express their feelings surrounding self-harm and urges when they want to self-harm, it can decrease the rate of patients actually self-harming. It's always important to educate patients and their family or social network on self-harm and what to do if the patient self-harms. This way, if the patient does self-harm again, their family or support system knows what to do and the patient has techniques to try and stop themselves from self-harming. We will talk more about teaching points on the next slide. Another intervention is to remove any sharp objects or anything they can use to harm themselves, especially while attending treatment, as treatment can be challenging for patients, and it is important to provide a safe environment for them while they work on learning what you are teaching them. Finally, providing medical care to any open wounds a patient might have ensures that they are at a lower risk for infection and allows for the opportunity to teach them how to care for their wounds going forward, and what to expect in terms of scarring. One important aspect of helping patients who self-harm is to identify what triggers there are and help them avoid it or teach them coping skills in order to overcome their desire to harm themselves. As mentioned in a previous slide, some triggers that can cause self-harm include PTSD and dissociative identity disorder. However, the trigger can be any number of underlying causes or external causes. One way to help patients deal with triggers is to teach them coping skills such as distraction or asking for help. Some distraction techniques that have been found to be helpful are taking deep breaths, snapping a rubber band when a patient feels the urge to self-harm, call a member of their support system in order to vent or talk about their feelings, and finally going for a walk or doing some other form of exercise that helps them keep their mind off the urge to self-harm. Another big part of coping skills that are taught to patients is when to ask for help and to let them know it's okay to call support lines or seek help if they are feeling self-injurious or if they have self-harmed recently. Another important aspect of teaching is to enhance a patient's self-esteem because a patient's self-worth can get crushed from self-harm and triggers, so it is important to help them build it back up in an attempt to help them decrease their self-harm. One last point is that it is important for nurses to teach each other and to reflect on their own feelings and attitudes towards self-harm. This is an incredibly important aspect because judgment or criticism can lead to patient increasing their self-harm. Therefore, ensuring that you have an open and non-judgmental manner can help the patient open up to you and help them heal quicker. Treatment for self-mutilation is based on the adolescent's specific self-injury behavior and any related mental health disorder, such as depression or borderline personality disorder. Overall, treatments for self-mutilation aim to reduce symptoms which cause an adolescent to self-injure. Furthermore, the research has shown that the most effective interventions for symptom reduction involve a combination of behavioral therapies and medication. The individual's needs are determined by a thorough psychiatric evaluation, focusing on the critical safety issues, suicidal risks, and presentation of comorbid psychiatric conditions. Based on this assessment, the most appropriate treatment options for the adolescent may be chosen. These treatment options include psychotherapy, individual therapy, group therapy, family therapy, medications, and psychiatric hospitalization. Psychotherapy is also known as talk therapy or psychological counseling and can help individuals identify and manage underlying issues that trigger self-injuring behavior, learn skills to manage distress, learn how to regulate emotions, learn how to boost self-image, and learn to develop skills to improve relationships and social skills, and learn to develop healthy problem-solving skills. More specifically, individual psychotherapy such as cognitive behavioral therapy and dialectical behavior therapy may also be helpful in an adolescent's self-mutilation treatment regime. Cognitive behavioral therapy helps an individual identify unhealthy negative beliefs and behaviors and replace them with healthy positive ones. Dialectical behavior therapy is a type of CBT that teaches behavioral skills to help with emotional regulation, interpersonal effectiveness, distress tolerance, core mindfulness, and self-management. DBT combines cognitive and behavioral techniques with mindfulness, which helps the patient to manage distress and improve interpersonal effectiveness skills. Treatment using DBT focuses on identifying and creating interventions for disrupting destructive behaviors. Research has shown that DBT is the most effective treatment form of CBT because it focuses on the depressive symptoms, suicidal cognitions, and problem-solving deficits that lead to self-harm. Additionally, DBT is the go-to treatment for adolescents who have features of borderline personality disorder. In addition to the individual therapy sessions mentioned on the previous slide, family therapy or group therapy also may be recommended. Involving family in the support and treatment of adolescents who self-mutilate is very important because family members can learn de-escalation strategies, improve listening and communication skills, and assist with development of safety plans. Currently, there are no specific medications approved for the treatment of the adolescent who self-harms. Because of this, pharmacological treatment should primarily focus on the underlying psychiatric disorders such as depression and anxiety, which commonly accompany self-mutilation. Psychiatric hospitalization may be required for those adolescents who injure themselves severely or repeatedly. Hospitalization can provide a safe environment and more intensive treatment until the individual resolves the crisis. Day treatment programs may also be an option. There are several community resources available to help patients who are self-harming. It is important to pass this information along so that patients know they have lots of different options of support available to them during times of crisis. Self-mutilation can be defined as intentionally harming oneself without having thoughts of suicide at that point in time. However, statistics show that 50% of those who self-harm will attempt suicide at one point in their lifetime. Self-mutilation is most often an outlet to express emotional distress or physical discomfort. Adolescents are the most prone to self-injurious behaviors. There are many forms of treatment available, such as support groups, family therapy, psychotherapy, and different medications. And most importantly, as nurses, we always need to be assessing the risk for serious harm, regardless of self injury intent. So, here are references, and I want to thank you for tuning in, and I hope you all have a great spring break.